Away from politics, now to health. With over 34 million COVID-19 vaccines received, Ghana is on the verge of a total breakthrough from the economic crippling pandemic. That's according to Dr. Kwame Amponsah, Director of the Expanded Program on Immunization at the Ghana Health Service. Speaking at a press briefing for COVID-19 Vaccination Day, Dr. Chianu said that barring any hatches, Ghana should be out of the woods soon after achieving its target for COVID-19 vaccination. There's more in this report.
The COVID-19 vaccine has been touted as the antidote to hospitalization and death from the COVID-19 virus. Hence, the decision by governments and the WHO to have citizens vaccinated to reduce the adverse impact of the pandemic. However, the vaccination program the world over has been plagued with conspiracy theories as well as cultural and religious beliefs and practices. Director General of the Ghana Health Service, Dr. Patrick Kumabwaji, cleared the air on the claims about expired vaccines being administered.
We've seen information about expired vaccines. Let me explain. It normally would take years to develop vaccines because you're waiting for stability to see the shelf life. This is a situation where the world had to come up with a vaccine, so we have been given different shelf lives. We continue to check for stability. So as the time approaches and stability is still there, WHO and the FDA extends the vaccines. The current vaccine expired for Pfizer is 15 months and not the 12 months as stated. So this issue that we are administering expired vaccine is not. In 15 months time, if it still remains stable, the World Health Organization and other regulatory bodies won't extend or issue because it's safe.
Director for the Expanded Program on Immunization, Dr. Kwame Amponsah, announced the strides Ghana has made in the vaccination drive and announces measures put in place to consolidate the gains.
So as we go on, we are improving, and we think that we still have a long way to go. We started tracking
Stephen Mensah's report read
to you. We did a lot of fanfare and social mobilization, community mobilization. We had nearly 3 million doses. And in January, which was a bit quieter, we did. Then in February, when the National Vaccination Days started, we saw that we had peaks. And since that, because of pressure of time and response to multiple outbreaks, we haven't been able to do any after the 4th. And so we think that going forward, the strategies of the vaccination days have come to stay. And so we are hopeful that in December, just before the festive season, when we do this, we know we will get as many people as much as possible.
The WHO, led by Dr. Elizabeth Jima, commended the country for the impressive effort and the great numbers of vaccinated individuals over the period.
Let me start by extending our sincere appreciation to the Ministry of Health and the Ghana Health Service for the unwavering commitment shown in deploying COVID-19 vaccines to the people of Ghana, particularly to the most vulnerable groups, and the phased approach extending it to the whole population in